not useful, more popular recently, which is plasma-rich platelet therapy. And I know you dabble in a bit of that as well. I won't say dabble, you use that, very effectively. Tell us a little bit about that, because again, it's another thing that kind of been sitting around on the fringes for a long time. It's starting to get a bit more mainstream now, more in the beauty end of things rather than treatment wise. But interestingly, when it's used properly, it actually has a really good regenerative effect.
Yes, yes. So platelet-rich plasma it's almost like a variation of stem cell therapy. So it's utilizing your own blood. What we do in this procedure is we draw your blood, we spin it in a centrifuge very, very fast, and this separates out some of our growth factors and all of these good cells that will help our bodies to regenerate cells and tissues. And the difference between that and straight stem cells is if you're just using stem cells, you're getting a lot more. It's a lot more powerful, okay? But with PRP, the nice thing about that is it's a lot less expensive. You are using your own cells. But what I like to utilize PRP a lot with, one of the things that I have coined is my PRP facelift, which is, in and out of the office. And so I actually, after we make your PRP, I use activating agent and we re-inject it all over your face. And this is what helps to keep our skin looking young. This is like the external that gives you that glow. It helps our bodies to produce more collagen, and it helps with fine lines and preventing some of that crepiness. And, you can usually tell when somebody's had a lot of like PRP facelifts because they really just have that youthful looking skin. And, even when I have patients that come in that want to have, Botox or filler, I always encourage them, let's do the PRP facelift first, because, you can put all the plumpness you want underneath that skin, but if what's on top of it is not looking healthy or robust, it's going to look weird.
There's also a lot of beauty therapists will use like an abrasion technique to try and create trauma to the skin and try and do the same thing but with a different process, right? So they'll try and traumatize the skin, cause it damage, and then just kind of leave it to the innate system to try and repair that.
Sure.
I'm not sure if it's quite as effective as the platelets.
So you do have to be careful, with especially the skin on your face, because it is much more fragile. And based upon the research that I've done, things like, there's interchangeable names, the vampire facial, where they're really making your face like bleed and really cause trauma. You have to be very careful because over time that can actually cause scarring, even if it's not right on top, underneath the skin. And this is going to change your skin over time. So you still want to keep in mind some of these kind of drastic procedures. Be careful.
Yes, absolutely. Totally agree. And using PRP is going to be something that's going to be a lot less.
Definitely. And we can even use, in some of my procedures, using like exosomes for that to help like stimulate this regenerative. I'll share. I know you brought it up at the beginning. I'll share. So one of my own personal issues is it's genetic, it's in my family. We all have these big bags under our eyes and dark circles. And so what I have started to do is for myself, and actually I've utilized it with some of my patients now too, because they saw my results, but I'll actually inject PRP and exosomes into my tear troughs. And so that has, my skin, you don't see the puffiness, you don't see the dark circles, and it's made such a huge change. And something really cool that I noticed with this procedure is I never had a huge issue with dry eye, but occasionally when I get tired, my right eye gets dry to the point that I have to take my contacts out. But I noticed about a month after the first time I did this procedure, the dry eye stopped. And so that's also an example of how powerful these exosomes can be in anti-inflammatory and making our cells communicate and work properly. I actually got rid of my dry eye from utilizing the exosomes right around that area.
Yeah. Inflammation seems to be one of the foundational causes of many disease and illness, and aging is not a disease as such. It's just one of those natural things that we go through. I am all for anti-aging, don't get me wrong. We want to slow it down as much as we can, but inflammation caused by, as you said, environmental toxicity, stress, poor food choices, and viral infections, bacteria, all sorts of trauma, it can be anything causes it. Getting anti-inflammatory strategies into someone's life and lifestyle is kind of one of the best things we can do for them, because it just means that everything is working better and not having to deal with this inflammation. So any of those procedures that you spoke about, they're all based around anti-inflammatory results. And that kind of is where we need to be, whether it be, changing your diet to something that is paleo-esque, and so you don't create inflammation that way, or you've got an injury and you're bringing it down using stem cells, or you just want to rejuvenate everything. They're all based around the same kind of thing. So they're really good additives if we can afford them and we can use them to anybody.
Definitely. And that's what, when we talk about anti-aging, it's not just all about, I want to live X number of years more. It's inevitable. We're all going to die, but we want quality of life. And when we can, when we talk about inflammation, that's like the foundation of us. Like, we want to always be mindful of inflammation. And when we reference inflammation, we don't mean just your sore knee or your sore back. We're talking about tissue inflammation, cellular inflammation. If we can keep this under control, that's what's going to help give us like healthy and meaningful longevity. And this is one of the things that in conventional medicine, they really don't address. When you go to the doctor for your physical, they say, what are your symptoms? What's wrong? And if you don't have anything wrong with you at that point, they say, okay, you're healthy, your physical's good, goodbye. Versus like what you and I do is, we're looking at lab tests. We're talking about lifestyle. We're actually getting, we're going 10 steps beneath just the annual physical to see what could potentially be brewing there that we need to work on now, so that you don't have to go to the doctor and say, now I'm dizzy all the time, or, I have pain everywhere. We want you to optimize your wellness.
Absolutely. There's an interesting study a few years ago from the NHS here in the UK. It's on their website, which is really interesting. And it says that 45% of GP visits end without a diagnosis. In other words, they don't know what's wrong with the patient. 45%, that's nearly half. So, there's a lot of variables to that. They only get a very short amount of time with the patient. They can't do a full history and so on and so forth. But generally, if people are going to the doctor for some sort of health advice, they're not actually sure what is wrong with them. And the other problem is they don't have, you can't manage chronic health issues in a 10-minute, or I think it's 7 minutes now, consultation. That's something that needs to be monitored regularly over weeks and months to make sure lifestyle changes are working and you're able to comply with them, and you're not just given some sheet of recommendations and you just don't know how to use it properly. So you're right, GPs do a great job the way they can, but we need to look a lot deeper, and often inflammation is the start of something. If we're using stem cells or exosomes or whatever it is you're going to use, what are some of the, I know you touched on it briefly, but what are some of the diseases or infections or whatever else it is that would really benefit from that?
So with stem cells, joints are huge. As I said, I brought up knees a few times. I love at my academy that I'm in, they said I'm like the natural knee doctor because I love working on knees because we get these great results from it. But I think it's in South America, they have been, this is really, I think it's so amazing. Patients that come into the hospital with a heart attack, an acute heart attack, they are injecting stem cells at the time of the heart attack, and they're realizing that it's lessening symptom and outcomes, and it's getting oxygen and healing to the heart faster. So they're having with heart attack patients, they're seeing great results with this. Obviously, I'm not dealing with that, but I'm constantly reading the literature, and I'm like, wow, this is so cool.
I think that's in Panama. That one. I think
there's several countries where they've been doing it. Actually in Japan, I spoke of Alzheimer's, and I was reading a study that it's actually approved to use stem cells for Alzheimer's patients to prevent worsening of symptoms. I've had patients that have come in for chronic fatigue, of course, anti-aging, vertigo, diabetic patients, asthma patients, sports performance, sexual enhancement. It's amazing what these are doing.
Okay. So from a personal perspective, right? I've got a torn meniscus in my right knee. Mm-hmm. I spoke with the consultant, and they said we've got two options. We can open it up, well, it's keyhole, but they'll go in, do some fixing up of it. 6 weeks recovery, and away you go. But that doesn't prevent any degenerative problems in the future. And then I said, well, what's the other option? And he said, well, we just leave it. Okay, that sounds good to me, because as soon as he said general anaesthetic, I just didn't feel like I wanted to do that. Right? So there's that problem. I'm also an APOE4 gene recipient, so I'm, according to literature, you have 25% more chance of dementia, Alzheimer's, that kind of thing. And one of the things that improves your chance of not getting dementia and Alzheimer's is deep sleep, right? Get deep sleep, and it clears out that amyloid plaque that builds up during the day and whatnot. And I also have a gene that says I've got a propensity to not be a very deep sleeper. So all of the cards stacked against you, one would think. However, from a preventative perspective, if I then turn around and said, right, okay, I want to keep the inflammation down, I want to make sure that I've got as little chance of getting dementia as possible, or cognitive impairment. Clearly, I need to eat a diet that is anti-inflammatory, that keeps my blood glucose down, that allows me not to cause inflammatory response just from what I'm eating. But then using stem cells maybe a couple of times a year, or some of the other therapies might also be a good addition in preventing rather than trying to cure. Would you agree with that?
Yes, I completely agree. And it's interesting. I was literally having this exact conversation with one of my colleagues yesterday regarding the APOE4 gene that increases risks of Alzheimer's. And they had a patient that came to them for stem cell therapy after I don't remember which joint it was, but they had surgery for it first. And the surgery didn't even help. And not only did the surgery not help, they went under general anesthesia for the surgery, and they came out with an accelerated, it was like instant dementia. They were having huge cognitive problems. So then they came to my colleague for stem cell therapy, had the stem cell therapy, they had joint improvement, and now, up until now, I don't remember, it's been several months, they have also had cognitive improvements. So going back to your knee and, weighing out pros and cons of, do I need to get surgery? You said, I have 6 weeks of downtime. I'm going to go under anesthesia. Obviously, there's a lot of pain involved in the recovery.